welcome to Informed Choices, Improved Outcomes, the power of self-advocacy in myositis care. I'm your host, Rachel Bromley. I am TMA Senior Manager of Patient Education Support and Advocacy, and I am so happy that we are speaking today with Dr. Bar Ventura. She is a rheumatologist specializing in inflammatory myopathies and interstitial lung diseases. She is the director of the University of Chicago Myositis Center and part of the University of Chicago Multidisciplinary Interstitial Lung Disease team. She is passionate about developing trusting and compassionate relationships with her patients who are diagnosed with all types of myositis and working to improve equity in healthcare. Dr. Bauer Ventura is also a clinical educator and is involved in the teaching of medical students, internal medicine residents, and rheumatology fellows. Dr. Ventura, thank you so much for being here.
Hi everyone. Thank you so much for having me today. It's so nice to be sharing this moment with you all. Should I share my screen now, Rachel?
Yes, that would be wonderful. Thank you so much.
Right.
For those of you out in the audience, if you have a question, you can put it in the Q&A box at the bottom of your screen. You can also in the chat box tell us where you are tuning in from. We'd love to see where you are from. And but make sure any questions you have go in the Q&A and not in the chat. And we will get to those at the end of the presentation. Go ahead, Doctor.
Okay, well, again, hi everyone, welcome to this webinar. It is really my great pleasure to be here with you talking about a topic that is very close to my heart. Again, the title of our conversation today is Informed Choices, Improved Outcomes, the Power of Self-Advocacy in Myositis Care. And a little bit again about TMA and our mission. Vision is that the Myositis Association strives to improve the lives of persons affected by myositis, funding innovative research, increasing myositis awareness and advocacy. And together we envision a world without myositis. And a special thanks to Octapharma, who is a sponsor of this webinar and has provided sponsorship to many educational activities to our patients through TMA. Okay, Rachel already nicely introduced myself. I'm not going to take more time with this. So let's move on with our agenda. So today we're going to learn a little bit about self-advocacy and its potential to improve outcomes in patients with dermatomyositis specifically. We want to understand how self-advocacy works, and then I'm going to give you a few tips and my experience as a myositis expert in this with respect to self-advocacy. And we're going to provide resources that will help empower you to be your best advocate. So when I talk about self-advocacy, what does it mean? Self-advocacy basically means collaboration. While developing treatment plans and also establishing a diagnosis of myositis, the truth is that this is not a unilateral thing. It really comes from the interaction between patient and their caregivers and the healthcare provider on the other side. And both sides need to be coordinating, communicating with one another in order to together make the best treatment plan for that specific patient. So self-advocacy is really about that collaboration, about a clear communication between those two parties. And it will be really important in understanding what is going to be the best treatment plan that will work for you. Self-advocacy, it is a dynamic thing. So when one engages in self-advocacy, we are talking about a lifetime of engagement. Remember that unfortunately, myositis, and specifically here, dermatomyositis, are chronic conditions. And they will live with a patient, they will be with a patient for a lifetime. We don't yet have a cure to these conditions. And also, dermatomyositis is a very dynamic disease. In some patients, it has that recurring, remitting kind of pattern of disease. Some patients have control of their disease with specific flares throughout their lifetime. And some patients have chronically active dermatomyositis. What I'm trying to say is that the dermatomyositis, the way it presents in oneself, really changes over time. And there are many kind of environmental and internal factors that contribute to the activity of this disease. Because it's so dynamic, your expectations of treatment, and also your symptoms change over time. And our responses to treatment and our expectations with respect to treatment also changes. And one needs to communicate your preferences and your needs when we are talking about management of dermatomyositis with your healthcare provider as the disease progresses and changes over time. I just want to give you a quick example. A patient can be diagnosed with juvenile dermatomyositis, for example, at very young age. And when that person turns 20, 30 years old and is interested to get pregnant, for example, the treatment may change, right? That patient can be in remission for a long time with the very same treatment for many, many years. But our perspectives on their preferences and needs will definitely change if the idea of conception and pregnancy comes into play. So my perspective as a physician will be dramatically different. How do I manage these patients with dermatomyositis at this point? And what are the treatment options that I have in mind? From the patient perspective, are we going to be concerned about flaring during pregnancy? Are the treatments going to be different during pregnancy if she flares? What is going to be our treatment? How frequent are we going to monitor this patient? So again, this is just a quick example on how things can be really dynamic and change over time, even if the disease is under remission. So there is actually good data that self-advocacy improves patients' outcomes. Knowledge is power. So when a patient is self-advocating, and I'm going to use as a synonym to self-advocacy as when a patient is actively engaged in their medical care, with respect to dermatomyositis, we know that those patients, they know better about the disease. They spend time and effort and energy in learning more what the disease is, what are the options in terms of treatment, what are the possible complications that can happen over time. We also know that when a patient is empowered with knowledge, that anxiety goes down because they understand there are a few things that they can control. It's under their control when we are talking about treatment, when we are talking about complications. And when those things are clear ahead in front of them, when those complications and concerns come to the realm of awareness, anxiety goes down. And when anxiety goes down, stress goes down. And then when stress goes down, quality of life improves as well. When patients are better equipped with respect to their understanding of their disease, treatment options are better. Also, if they communicate better with their provider, their needs and preferences, they can better choose what treatment fits them better. Therefore, treatment is usually more successful. And when we have a better understanding of the patient's specific needs and preferences, there's also less conflict between patients, caregivers, and healthcare providers. And a medical care that is devoid from conflict, that runs way smoother, is so much better for everyone who is involved. So again, a patient who is actively involved in their care, which means it is self-advocating doing their medical care for dermatomyositis, overall has better outcomes. And that's also my impression. I can tell a huge difference between the group of patients that I have who are active patients compared to the group of patients that I have that are more passive, who are not as engaged in understanding how their disease goes and also treatments and management and comorbidities that they need to be aware of. Let's talk now about practically what self-advocacy means. And I'm going to give you a few tips on things that can be really helpful for you to be the active, engaged patient, and therefore one that has a lot higher likelihood to have better outcomes when it comes to the treatment of your dermatomyositis. First of all, in order to be an active patient, in order to advocate for yourself, you need to prepare for your appointments. So when I talk about being active in your dermatomyositis care, that requires commitment. That requires that you prepare for your appointment. That requires that you are active during your appointment, and also that you reflect about the conversations that you have with your care provider after the appointment. And that comes, and this kind of responsibilities come to your caregiver as well, the person who is with you, joining you in this journey. So again, there's a lot that comes from the patient side in terms of commitment and time and energy before, during, and after the appointment, that will be really important in engaging into a better care for your dermatomyositis. I would like to say that when a patient it is engaged in their care of their healthcare, you also engage your healthcare provider. I am more willing to spend more time with a patient who is very interested to know better, who is engaged, who wants to make the difference for themselves and make the changes that are necessary together, than a patient who is really not coming to their visits or who is not really involved in the treatment plans that we are developing together. So let's talk about preparing to your appointment. Now we are pre-appointment phase. You know you're coming in, let's say this Friday. How can I get ready for that appointment? Remember, healthcare providers, unfortunately, the way the system is, they have limited amount of time. So you want to use every single second of their clinical visit to make it worthy. One, your investment financially, your investment of time, and also your energy. You're gonna be there. You're gonna rather you probably would rather be somewhere else working with your family, and you're actually spending time to be with your provider in that clinical visit. And here in the QR code, you can scan it, and you're gonna be directed to a very nice PDF document. Dr. Pharma developed the pre-appointment guide, and this pre-appointment guide has many interesting questions and checklists that you can go over. They really summarize the important topics that you should not miss before your appointment, in preparation for your appointment. So
Hey,
a few
real
things.
quick,
Yes.
Doctor, I just wanted to say real quick to let everyone know that every QR code you see in this presentation will be sent out with instructions of how to access it in a email that we will follow up with you next week.
Perfect. Thank you so much, Rachel. Okay, so what is in there in this pre-appointment guide that you can use from Octopharm, or you can develop yourself? So basically, it is a very nice list of, what are the symptoms that I have experienced recently that I need to communicate to my provider? What is my agenda? Oh, doing this clinical visit, I really should not forget to mention that I'm going for a trip to Europe. I'm going to spend some time off. I need to spend some time off. I need an FMLA to be completed, or I really don't like the medication that I'm taking right now, and I need to discuss other options. So again, this very nice list of questions that will set the agenda, will set the tone for our clinical visit. You can also you can also prepare yourself in terms of studying. I know I need to change my treatment. I know my treatment is not enough to get my disease under control. My dermatomyositis is active. What if I do a little bit of research and understand what are the options? What are the medications that are in the horizon that can help me to get there? So when I get to my provider's appointment, I have a better understanding what are the options that can be discussed at the time. You can ask someone to come with you for the visit. And remember, we are all very busy nowadays. So if you ask in advance, you have higher chances to actually have someone to join you in the visit. And this is particularly important if you know you get easily overwhelmed doing medical visits for whatever reason. If you need someone to be an extra set of ears during the visit, so you don't forget what is relayed to you in terms of information during the visit. Or if you just want that support, you want someone to be there with you, because, it can be quite anxiety driven to come to your doctor. If the dermatomyositis diagnosis is still playing an important role in your mental health. So again, those are overall good tips on how to prepare to a healthcare appointment. Remember, I mentioned to you, knowledge is power, and it really is. But in order to get good knowledge about dermatomyositis, you need to look for good resources. Internet is absolutely wonderful. Everything is out there. If you really want to spend the time, you want to find the good stuff, because unfortunately, there's a lot of misinformation in the internet as well. And misinformation when it comes to your health can be detrimental to your health, can cause you problems. So we really want to make sure that you're looking for the best resources. Those are some examples that are easily available in the internet that are here in QR code. And as Rachel said, you're going to be emailed later with this information. So don't bother if you cannot scan these QR codes right now. So the Cleveland Clinic, the Hopkins Myositis Center, TMA, of course, and WebMD do have reliable information about the myositis treatment, symptoms, so on and so forth. Now, let's talk about while you are in the appointment. What can you do to make the best use of every single second that you have with your healthcare provider? One thing that is really important is that you need to be open to answer questions and to ask questions. So don't withhold information from your healthcare provider. It is for your best intention to be open to understand, so your healthcare provider can understand what are your needs, your preferences, so we can together develop the best treatment plan for you. Take notes. Again, if you know that you're not gonna remember everything that is being discussed, or if there's a lot of information, these clinical visits can be extremely information dense. If you know those things overwhelm you, please take notes. By all means, some of my patients come with a little file. They have a pad. Some of them come with their computer, and they take notes during our conversation. One thing that is really important is that you should definitely bring your material, the one that you prepare in advance for your visit. And as I mentioned to you, be open to explore your treatment goals with your provider. Tell your provider, what are your expectations with the treatment? What is bothering you? What has worked? What has not worked? So we can together, you and your provider, develop the right tone of your treatment. There are several things that must be discussed when we're talking about treatment of dermatomyositis. The treatment for dermatomyositis, as we have discussed, has not yet yielded a cure of the disease, but it can be really helpful in controlling symptoms, improving the quality of life, and also the lifespan of patients with dermatomyositis. There are several things that play a role when deciding what is the best treatment for you. And a few things are related to accessibility, safety, and your preferences. So unfortunately, many of the medications that we use are expensive, and insurance coverage can be an issue for many patients. And those financial factors play an important role in deciding which treatment option is the best for you, unfortunately. We also need to understand that there's no medications on earth without any potential side effects, but that does not mean that potential side effects actually reflect in side effects for a patient. I cannot emphasize this enough. When you're reviewing potential treatments with your patient, with your healthcare provider, your healthcare provider should provide to you a quick list verbally of the most common adverse events or side effects associated with the treatment that is being discussed. I'm saying potential side effects, potential adverse events. Potential does not mean that they will actually happen. Many of our patients get so attached to that long list of potential side effects that they cannot start any medication, but they withhold in specific medications that could be really helpful in treating their condition. And by being so afraid of potential things that may happen, they don't have their dermatomyositis under control. And they are in greater risk to have their dermatomyositis progress over time and cause harm to many organs, skin, lungs, muscles, you name it. So sometimes being afraid of starting a medication because of potential side effects withhold them to actually live the best life they can be living. So I would like to remind ourselves here that when we are discussing treatment options with your provider, we are always trying to balance benefits and risks. And if we believe that a medication is feasible, will be an interesting option to you, is because we believe that the benefits outweigh the risks. And again, this is something that always needs to be discussed. Different medications will have different safety profiles, and it's really important that, again, you provide with clarity to your provider what is your goal with respect to treatment, and to also understand what is the goal of your healthcare provider in treating you. The other thing that is really important when making treatment decisions when it comes with patients is to understand also what fits your lifestyle. Some patients, for example, will come to me and say, Dr. Ventura, I just cannot take tablets. I'm going to forget them, or they are too big and I have swallowing problems because of the dermatomyositis. There's no way I'll be able to take this tablet several times per day. For those patients, maybe having an IV or an injectable medication will be a more interesting option. Some other patients come to me and say, I am deadly afraid of needles. Please don't stick me more than you need for blood work. And I'm not going to take a medication that will require me to go to an infusion center or learn how to inject myself. That's totally fine. Again, those are preferences that needs to be clearly communicated. When it comes to potential options for treatment, overall, the treatment for dermatomyositis, when it comes to medications, rely on 3 pillars. We have intravenous immunoglobulin for the treatment of dermatomyositis. They are providing antibodies that can actually regulate your immune system, and by doing so, can help alleviating the symptoms of patients with dermatomyositis. And the interesting thing about intravenous immunoglobulin is that this treatment is not immunosuppressant. Many patients, for many different reasons, would like to avoid medications that decreases their ability to fight infections, either because they had many infections in the past with other medications, or because they are higher risk to develop infections. Intravenous immunoglobulin is a very interesting option with that respect because it's not immune suppressant. It comes with the caveat, though, that it requires a lot of time commitment for patients because intravenous immunoglobulin, as the name says, goes through the vein. So you need to go to an infusion center or to have a nurse visiting you at home to be able to infuse the medication. And usually the medication is infused between 2 to 5 days, normally every month for several months. Some patients are on intravenous immunoglobulin for several years. And you can understand that can be problematic for some patients who cannot transport themselves to an infusion center, or if the patient is traveling quite often, or is a busy working mom. So many, again, your needs when it comes to lifestyle are important to make decisions if this medication is the right one for you. Corticosteroids. We are talking here about prednisone, Medrol, methylprednisolone, which are oral, injectable, or IV medications. If you have not taken these medications for dermatomyositis yet, there's a chance that you may, and you probably have taken in the past, or you probably are still taking these medications. We don't know yet of a medication that works as fast as the steroids. They can be extremely helpful, particularly in the beginning when the disease is very active or during a flare. But the problem is that steroids are not long-term solution for dermatomyositis, basically because they have a very long list of side effects. And the risk that one will develop side effects with steroids are proportional to the duration of treatment. So the longer you are on steroids, the more likely you are to develop side effects. And also to the dose of steroids. Again, the risks increase as the dose of steroids increase over time. So because of those concerns, we as physicians would like to avoid using steroids as a long-term plan and utilize other medications such as intravenous immunoglobulin as a replacer for steroids over time. Now we have our third pillar in terms of treatment, which are your immunosuppressive medications. These medications are used often, again, in conjunction with steroids and sometimes in conjunction with immunoglobulins as well. And they can be very helpful in treating dermatomyositis too. Some of them are oral treatments and some of them IV and injectable treatments as well. And as the medication, as the name says, immunosuppressants, they decrease your ability of the immune system to fight infections. So overall, as a group, as it happens with steroids as well, they may increase your risk to develop infections and more severe infections. Now we are gonna talk, you prepare for your visit, you discuss all that big agenda you had during your clinical visit, and now we need to talk about your after visit. So it is really important that after you meet your provider, sit down and reflect about what has been discussed. Go back to your notes, trying to make sure that you understood everything that was relayed to you. and trying to understand that if you actually ask all the questions you wanted to ask during that visit. Your after visit engagement is also very important because, again, a lot of the things that will, when with respect to decision making in terms of treatment and diagnostic testing, was defined during your visit. And again, the several weeks and months that will follow that visit may be dramatically changing depending on what has been discussed. So make sure that you're comfortable after your appointment with what has been discussed. Other things that I would like to mention about the after visit moment, it is that this is a moment for you to also understand if the relationship, the collaboration you are developing with your healthcare provider is one that is enough for you when it comes to your satisfaction in terms of how your dermatomyositis is being treated. Remember that dermatomyositis is a pretty rare condition. There is little yet that is known about this condition, and a lot of what providers, healthcare providers inform you, some of it is related to evidence-based and data, and it, of course, reflects our studying of this topic over time. But a lot of what myositis experts also use to help inform the decisions when seeing a patient relies on the past accumulated experience that we have had by seeing other patients with dermatomyositis. What I'm trying to say is that there is a lot that play a role on the treatment decisions and the management of dermatomyositis that is not a mathematical model. It's not something that is written in stone that every single provider follows through when seeing a patient with dermatomyositis. Therefore, some patients will feel more comfortable if they see a second or third opinion to make sure that, hey, this is really the treatment I would like to have moving forward. This is the provider I would like to have moving forward with me in this journey. So understanding if you would benefit from a second opinion is also important. And also make sure that, you know, the relationship you're developing with your healthcare provider is one that is satisfying for other reasons too. If you believe that your healthcare provider has not been able to meet your expectations, your needs in the way you would like it to be, maybe it's time for you to look for another provider. So all those things can be coming into play and coming to your mind after your visit. And finally, I cannot emphasize this enough, the importance of finding the right support group for you. Locally, nationally, it is really, really helpful to join those groups. TMA has several of these supporting groups. My patients who are the most engaged and who have really learned how to be best advocates for themselves are in supporting groups from TMA. And they have learned so much. And more importantly, they have really provided mental and spiritual and community help to others with the same conditions. And they have received the same from other patients in the supporting groups as well. So I cannot emphasize enough how helpful joining those support groups can be for this journey, which is a lifelong journey. I'd like to say a few words about patient portals. We are very lucky nowadays that we have electronic medical records, and most hospitals and most clinics where you see your myositis expert have patient portals. Patient portals are just wonderful tools to communicate with your healthcare team. I use it quite often with my patients. This is an opportunity for my patients to communicate about flares, side effects they're having with their medications, to discuss test results as they come, and also to ask questions that, again, they may have forgotten to ask when we're seeing each other and doing our visit, or to remind me about topics that are going to be important for them in the next upcoming appointment. So it's really wonderful to have this avenue of communication. I also mentioned to my patients, I rely on these patient portals to communicate with them. So this is the way I communicate with them that it's time for their blood work, or I would like to know if they have any feedback about their treatment they have just started, so on and so forth. So those things are really important. This avenue of communication in between visits is really important. Most often, patients don't see their myositis expert more often than every 3 months. And during that 3-month period, a lot can happen, especially if the dermatomyositis is active, and the patient portal can close that gap. That being said, with all the wonderful benefits of patient portals are not diaries. It's important that you keep your diary. It's important that you keep, again, your file or your notebook that you can write down symptoms, concerns, issues that you would like to discuss with your provider, so you can summarize them at your next visit. And if there is anything urgent, to communicate through the portal. But these portals are not diaries. It is really difficult as a provider to get these huge pages of notes very often from patients, and trying to filter what is really important that needs to be addressed right away before our next appointment. Is this something that it can wait a little bit? Is this something that is causing a lot of dysfunction for my patient? So trying to differentiate the importance of what is being relayed in those very long messages can be complicated. So for the best way to communicate with your provider, trying to be succinct and trying to reach out with specific topics that you know need to be addressed in between those visits. Remember, your provider, I can talk about my own experience. I spend about an hour and a half every single day answering patient portal messages. And it's really important that we are getting to the point in those messages, because unfortunately, we don't have more time to spend on those messages than we have right now. Those are, again, nice QR codes that can be scanned and will be provided to you by email later on, with those very nice guides that Dr. Pharma prepared in order to prepare yourselves for the medical visit, and also to aid on the decision-making behind your treatment plan. I want to mention that, again, self-advocacy, as I alluded to in the beginning of this conversation, is not a unilateral thing. It is really part of a collaborative effort from patient, caregiver, healthcare providers that would include nurses, physicians, pharma, and all others who are involved, supporting group members. There's a lot that plays a role in the active engagement of a patient with dermatomyositis. The more active you are, the more you engage a team, the more likely you are to have wonderful outcomes for your treatment with dermatomyositis. So I just want to mention to you that altogether, this is telling you that the dermatomyositis treatment and management is not a solitary path. It's one that must be trailed as a team, and you're not alone in this journey. So please make sure that you find a provider that can really hold your hand, and you have family, friends, and caregivers that will be also there to support you through this lifelong journey that I know is not going to be easy at times, and at times maybe a little easier, but together we can make this journey to be at least to run a little smoother than you would otherwise. And again, this is self-advocacy is really for everyone. So it is a collaboration between patients and healthcare providers when making decisions about treatment and in care in a condition that is chronic and it is dynamic. So your needs and your preferences will change. And also the field of myositis is changing, is always changing. Every single day you receive a new paper about the dermatomyositis with news, with changes. Your myositis expert may go to a conference and learn more about novel options. They're now being developed for the dermatomyositis, and they can come to you with interesting ideas for your next visit. So this is a dynamic field, and therefore our needs and expectations and demands will change over time. And that's expected. And that's the reason why this very close communication and collaboration between you, your caregivers, and your healthcare team, it is really crucial to get you success. All right, so we are going to open for a Q&A. I just want to put it back here. This very nice list of good resources for patients with respect to information on the dermatomyositis.
Well, thank you so much. And I've got a couple of questions that were pre-submitted that I'd like to ask. If you have any questions of your own out in the audience, please put them in the Q&A. I try to talk to my doctor about things I've learned at TMA's conference, but he doesn't seem to want to hear these suggestions and kind of blows me off. What should I do about this?
Yeah, this is the moment. Again, I really believe that a very honest communication between patient and healthcare provider, it is really crucial to achieve success. So if you are not satisfied with the communication you're having your provider, maybe it's time for to ask for a second opinion. Maybe it's time to consider meeting other physicians and understanding what kind of relationship it is necessary for you to be satisfied. This is a lifelong journey. So it is really important that you identify someone who provides you that sense of comfort and clear, honest communication. And also because the disease changes and your needs change, sometimes a provider was really helpful in the beginning. But now that you are in a different stage of your life, you may need a provider that has a different approach on things, or you're just willing to take a different chance and then look for different options that have not been explored with your previous provider. So I think it is always wonderful to open for the opportunity to re-engage your provider. Maybe it is a moment to discuss why you're not satisfied with the communication with your current provider. But if you feel like you're hitting a wall, maybe it's time to move on and ask for a second opinion.
My doctor never asked me what I think about the treatment he prescribes or what my goals or priorities are. Are you saying I should have some say-so about what medicines I should take?
I think you need to communicate for sure again about your expectations of the treatment and about your concern of side effects. I always tell my patients that, hey, I can do the best job possible in prescribing you the medications that I believe are the best for you. But in the end of the day, you are going to be the one taking the medication. You are going to be the one dealing with potential side effects, dealing with monitoring of blood work, taking tablets, taking injections, IVs. There's a lot of commitment that comes with being compliant to a medication. I believe that a patient can only be successful in being treated if that patient is really part of the team. This treatment is the best decision that both myself and my doctor come up with. This is our decision. This is a teamwork decision. If you're not part of that decision, the medication is not going to work. You are the one who's taking it. It is your best interest to be really involved in that decision making.
Going to the doctor has become a really anxious experience for me. I'm always afraid that there will be bad news or more tests or something bad will happen. So I find myself always trying to just show how much better I'm doing. I'm not sure this is a good idea though, since maybe my doctor isn't getting an accurate picture of my condition. Do you have suggestions for making this an easier time for me?
Yes, I totally understand that. And I have patients who suffer from the same thing. They're so concerned about bad news that they may underestimate what is going on or do not focus on the things that are troubling them. I have two suggestions. You can bring someone who you know is very honest. So maybe you have a partner, maybe you have a sister, a brother, maybe it is a neighbor who knows you very well and has witnessed your function in a daily life. So that person will be able to report honestly what they are seeing of your health status in a daily manner. So I think it's always great to find someone who knows you in a day-to-day basis to come to your appointment with you and then be able to report honestly to your healthcare provider. I think this is really helpful. And number two, trying to be honest about this with your provider. A patient of mine already said is like, you know me, I'm not gonna complain because and that's what she said, because I'm so concerned that we are gonna be focusing on the negatives. And I also want to mention to you that I actually have experienced some positives too. So I think it is always nice. This is how I open my conversation with patients quite often, is that, hey, tell me about what's going on that is not working well. Let's talk about your symptoms, signs, concerns. And also tell me from our last visit, what has improved? So we have a clear picture about things that are positive and negative. We don't necessarily need to be dealing with just one of those issues, the dermatomyositis care can come with both positives and negatives. And trying to verbalize both clearly to a healthcare provider is really important. So as a healthcare provider, will have a bigger holistic overview about how you're doing. And again, bringing someone who is really with you on a day-to-day basis can be quite helpful.
Well, the next question is about that exactly. I know it's a good idea to bring someone with me when I go to my doctor's appointments, just so they can help me remember what he says and be there to hold my hand. But the office staff won't let my friend in the exam room. They say it's for patient privacy, but I don't think that's right. I'm not really assertive, so I don't say anything, but I really want my friend to be there with me. What can I do?
You're allowed to bring, depending on the hospital policies, but now that COVID is lesser of a problem, at least during the summer so far, you're allowed to bring at least one visitor with you in most centers. I don't know of any hospital that you cannot bring a visitor with you. And whenever you are doing your physical exam or being examined by your healthcare provider, your friend can stay. So I would try to be verbal about this. Or if you know you're not super assertive, you can ask your friend who is there with you to say that clearly during the physical examination. When your provider asks your friend to leave the room, you can say, hey, would you mind if my friend stays here? I actually will feel more comfortable to have this family member or this friend here with me, even during the physical examination. So this is something, and your provider should be able to say yes. And if they don't, I will come back to the policies of the hospital. But as far as I know, there is no, that shouldn't be prohibited as long as the patient verbalizes their interest of having a family member or a relative to stay with them in the room during the examination.
How to advocate for yourself to get diagnosed when the area university center has turned down the local doctor's referral request? The local doctors do not do specialty testing or muscle biopsy.
So the question is how to get to the university if your consultation has been declined?
Yes, I believe so.
So I think a lot of times when universities, we don't decline those consultations here at University of Chicago, but I know of others who do. So a lot of times when a consultation is being declined, even before you get into and being able to schedule the appointment, is because whoever is reviewing the application for the consultation either don't have enough information or the information being provided is not helpful. So my recommendation would be request from your local physician to be more explicit in their notes to be sent to the university. So make sure that your local physician put in the notes the tests that have been done and the question that needs to be answered by the university center. For example, patient with suspected dermatomyositis, diagnosis has not been able to be established according to labs, EMG, MRI, whatever. Patient may need a muscle biopsy. We would like to request a additional evaluation, a second opinion from a myositis expert of this university center. You see, being specific about the question that is being asked, and also by providing the evaluation that has been already been performed, labs, additional testing, can be really helpful for whoever is doing the triage to go over this information. Is like, oh, okay, so this has already been done, and this is the question being asked by the local physician. It's much easier to get this patient scheduled in the myositis clinic with a provider.
Okay. I wanted to talk a little bit about something that I've seen in a similar webinar that we did with Dr. Andrew Mammon, and he was talking about when you're trying to find that provider, how it can be very helpful that there are providers who enjoy solving a puzzle and those who do not. And so when you're dealing with a rare disease that maybe they aren't an expert in, if they find that challenging in an enjoyable way, that's kind of a good thing to find up front. Have you experienced anything like that with your
Yes,
colleagues or
absolutely.
patients?
Yeah,
Hmm.
absolutely. So again, this comes down really to personality. Some
Hmm.
physicians are really wonderful at following a plan. They have a plan. They will monitor you very closely for side effects. They will discuss with you all the possible comorbidities or complications that you may have from your disease, and they will be able to be very closely aligned with your needs. But they have kind of already have a diagnosis and established plan in mind. Some other physicians are very, very intrigued and moved by diagnosis. So they have a puzzle in their hands, they have a case that is complicated. Nobody has been able to answer that puzzle, and they dive in as much as they can. They look, they talk to different providers. It's interesting you mentioned because I had a complicated case of myositis this morning, a patient who has been hospitalized 3 times for severe myositis, and we don't know her diagnosis. And I have done all kinds of testing, even genetic testing, and I have not yet been able to nail the diagnosis. I just emailed Andy Mamet this morning from the NIH. It's like, hey, Andy, this is what I have done. This is what I have in mind. Would this patient be like a candidate for a quick trip to the NIH? You see what I mean? So it really depends how engaged and how interested your physician is in this specific different type, like parts of a disease course, right? Diagnosis and treatment. Unfortunately, I cannot tell who is what. That's why I think it sometimes is important. I tell that to all my patients. It's like, hey, I do have an ego in the game. I'm here just to help you to feel better. If you believe that my approach, your personality, or whatever, it is not really fitting with your expectations, by all means, have a second, third opinion, trying to see which one fits better your needs at this moment. And unfortunately, the only way to do that is by trial and error sometimes.
It
Um,
really is. And I was wondering, is it something that like patients can do ahead of time if they have an appointment with an upcoming doctor and they want to know things like, um, are you open to the patient providing their lived experience and sharing resources with you so you can increase your knowledge of this particular rare disease? Do you like to solve a puzzle? You know, whatever these things are, is this something that can be shared with the staff of the office to do it beforehand, or is it just something you do in your very first meeting with that person?
it's hard to say. It is hard to ask those questions and receive honest answers. And again, I'm being very honest here.
Yeah, that makes sense. I
And
mean, it makes
also,
more sense that like if they're going to be open to having the physician 101 guide like we have, for instance,
right,
you
right,
can
right.
gauge their reaction when you bring that in.
Yeah.
Uh,
Yeah, but I really believe that sometimes the only way to know is by coming in and having that one-to-one interaction. There's a law that I really believe when it comes to a good relationship between healthcare providers and a patient, that is really that gut feeling that you're getting a good response, a good feedback with the information you're providing. And sometimes this is really in our first visit. So I cannot emphasize enough how that first visit is important. This is the moment when things click or don't click. And um, and again, this is really a trial and error situation. Unfortunately, I don't have a better way uh, to recommend it. You probably need to discuss with different providers and understand who is good at doing what. Quite often, patients come to me for a confirmation of diagnosis, and because they live far, they follow through with their local rheumatologist, who again is very good at providing routine assessments about adverse events, monitoring labs, so on and so forth. And they come to see me for important breakthroughs or discussions in treatment choices, so on and so forth.
okay. My doctor usually comes in to talk to me, but sometimes I feel like he is not listening. How can I advocate for myself if the main doctor doesn't listen to my concerns?
My honest experience is really be honest. I would like to make a note. Being honest does not mean
being
generate
mean
conflict,
or rude.
right? You can be honest and extremely and being still extremely kind and caring
Mhm.
and appreciative of one's work. But you can say it's like you can say honestly, it's like, oh, I understand you're very busy, but I have the feeling that we have not been able to address the concerns that I had. Would you mind revisiting them with me the next time when I come to see you? Because I have a breadth of questions that I would like to visit to discuss with you during our next visit. Is there any chance you can actually schedule me in a new visit slot so you have more time than a follow-up slot, for example? So
Oh,
those are,
okay.
or because I know a lot of patients come to me saying exactly this is like, hey, I know I'm a little more demanding because I have a lot of questions and I appreciate your time. Is there any chance we can actually see each other a little more often than every 3 months? I have a patient who I know is a little more anxious and needs my attention more often, and we are very open about this. So we know that he's a little more demanding than the average of my patients. Because of that, we schedule in advance visits there more often. So we have kind of check-in telephone calls every so often, and it has worked pretty well for us. So you see, it's all about adapting to demands from patients and also expectations and what your healthcare provider can provide as well. So this dynamic really has needs to be discussed with your patient. So and your healthcare provider. So trying to verbalize your expectation, your needs, and see how your provider can adapt to them.
Okay.
I plan
Um,
to move to another state in 6 months. How do I prepare in terms of finding doctors to treat the myositis, Sjogren's, and ILD? So TMA has a find a myositis expert link, kind of like search, search tool that can
it's
be
a
really
tool,
helpful.
yes.
And this tool can identify the best providers locally. So whenever, hopefully you know where you're going and you can type the zip code, the city, the state, and trying to identify where those people are. The nice thing is that every folks who are in that list, and particularly the big experts who have engaged with TMA in the past, they also have a TMA badge. We have a badge in that very nice searching tool, and you can identify those in our in the TMA website.
Yes, you just go to myositis.org and then support and then find a doc tool. And there's instructions how to best maximize that tool. You can increase how far you're willing to drive to get a doctor that knows more about myositis. And I do want to stress, though, that if your physician is, open to learning more and working in partnership with you, I do find that really valuable. So I don't want anybody to despair if they don't have a global myositis expert near them.
And also, if you
www.
have questions, we can always write. Rachel, TMA is also open to help providing that connection between centers and patients.
Myositis.org is the site, www.myositis.org. And we have had some feedback that sometimes they'll go in there and they'll get the list, and then they'll call and they're not taking new patients. That is not on MediFind or on TMA. That is the actual center needs to update it. So whatever complicated algorithms they're using can pull the most current information. What I would suggest doing is emailing me, Rachel@myositis.org. I'll put that in the chat and let me know where you're moving to, and I can connect you with the support group that's near that area, because that'll be a wealth of information about local resources and people that they use, that they like or don't like. And that would be great to get connected with that support network before you even get
Yeah,
there.
yeah. TMA has connected several patients with me. So it's not once or twice. It was like, oh, I actually reached out to TMA and I found out that a board member is that you're a board member and you are here in Chicago. It's like, yes, I am. So it has been really successful. So again, TMA and the supporting groups are just the wonderful resources to connect patients with myositis experts.
And my coworker Linda has put the Find a Doc tool and my email in the chat. And someone in the audience also brought up the book for physicians about myositis. It's called Physician's Guide, and you can contact TMA at myositis.org and get copies that you can share with everyone. And I would share them with your PTs and OTs and anybody that you want to learn more about myositis. So we are at time. Is there any last minute remarks that you want to share?
I really want to make sure that we all understand that in these very busy times, there are so many different conflicts and things that doctors and patients as well need to deal with, that it's really important to be honest, but at the same time being kind. Try to develop a healthy and kind relationship with your healthcare providers, because the truth is that it is very hard to treat someone who doesn't treat you well. So again,
Absolutely.
kindness and respect are important in both ways. And I cannot emphasize enough how much easier it is to see a patient. And the patient can be challenging for many reasons. The disease is active, there are many questions, that's okay. But when there is kindness and respect, everything goes better. So that's what I would like to say as my final remarks here. And again, I'll be delighted to join you for future TMA webinars. Thank you so much for the invitation. And again, if you have any questions, concerns, my email is also in the TMA website.
Yeah. All right.
And I see some of my
so
patients here in the chat. Hi everyone. So nice seeing you. Thank you so much for joining me today. Hopefully I was truthful to our relationships.
Absolutely. I'll give you time to read those nice comments in the chat. Just while I say, kindness is so important. I've found that it's easier for me to be kind the more unassuming I am. For instance, you could really say this person's not listening because they don't care. When it is, maybe they're busy, maybe they have problems at home. They may have lost a family member. You never know what's going on with someone.
You never know. Exactly.
Being unassuming is really helpful.
And again, that's when honesty comes as like, hey doc, maybe you're not having a good day. Maybe we can touch base later on. And that's okay. All of us have bad days, good days. And again, trying to be open-minded and warm-hearted goes a long way.
Absolutely. All right. Well, thank you, everybody. And tune into our events calendar. July is going to have several wonderful webinars that we have planned for you, and we would love to see you there. So go to myositis.org and click on events calendar, and we will see you at the next webinar. Thank you.
All right. Awesome. Thank you so much, everyone. Bye-bye. Ciao.
Bye.